Hello and welcome to Rainbow Pagan. Today's video, I'm going to tell you a little bit about schizophrenia related to schizoaffective disorder. Now, these two disorders are very similar, and it is very hard for doctors to diagnose. Now, I will tell you the truth. I've told you guys that I have schizophrenia. That is my personal feeling and what I've heard from other doctors. By that is, I mean, I have seen many doctors when I was sick, when I was ill, and my illness is not controllable. And I have had, let's say I've seen, for argument's sake, 5 doctors. Or 4 doctors, actually. I would have 2 doctors telling me I have schizophrenia. And I have another 2 doctors telling me I have schizoaffective disorder. Now, today I talked to someone at my clubhouse, the Sunday clubhouse, which I will do another video about. And he was a very smart guy, and he sat with me, and he was telling me, you know, he's worked in the mental health field for many years, probably over like 15 years, and he sat with me and I told him I want to find out the difference between schizophrenia and schizoaffective. I know that they're very similar, and my doctors have always had that argument with me. And he told me probably why they're having a little debate is that my father definitely had schizophrenia. And since schizophrenia runs, and it is genetic, that they feel, you know, and then this label schizophrenia. Now, remember, people, that these are just labels, and they are not who you are. But for me, it's been a pain in the butt when someone can't tell you what's really not so wrong with you, but what illness you have. And if you have schizophrenia or schizoaffective disorder, it can be a pain, and you probably know what I'm talking about. But I'm going to read a little bit here about the disorders. I know that you don't like me reading it to you, but I have little paragraphs here. First of all, for you people that don't know, what is schizophrenia? Schizophrenia is a clinical, severe, and disabling brain disorder that affects about 1.1% of the U.S. population, age 18 and older, in a given year. Now, I have had signs younger than that, and that's probably why they have arguments also with that. Confusion, because I started having signs of schizophrenia, of seeing things and hearing things when I was 14 years of age. People with schizophrenia sometimes hear voices, others don't hear. That's another thing. I hear voices. Believe that others are broadcasting their thoughts to the world, which means, other words means that a person feels the government is going after them. I know that can actually, it's kind of true, but I mean, this person will think their phones are tapped, the government's keeping tabs on them, people are always stalking them, stuff like that. Believe that others are, I'll read that side, or become convinced that others are plotting to harm them. These experiences can make them fearful and withdraw any case difference between they try to have relationships with others. Meaning, I'm sorry my reading is so bad because I only have like a certain grade level of reading, and I can't really read big words. Mainly what they're trying to say here is that people with schizophrenia will have a lot of problems with relationships, not wanting to get close to people, afraid to get close to people, stuff like that. Signs and symptoms, okay? Symptoms usually develop in men in their late teens or early 20s, and women in their 20s and 30s, but in rare cases can appear in childhood. They can include hallucinations, which I have, delusions, which is the government conspiracy thing. Disorderly thinking, which kind of means not thinking clearly. You don't process things before you say them, something like that. Not really sure about that one. Movement disorder, which means constantly move your head around, stuff like that. Kind of tricks. You have little tricks too. I have that. If you have seen in some of my videos, I really look like that sometimes when I'm talking to you, or look beside me. Yeah, I have that, but not really bad. There's someone at the clubhouse I've actually seen really bad with that. What is it? Where was I? But in rare cases can appear in childhood. Now that confuses me too, because like I said, I was a teenager, but that's still considered childhood. They can include hallucinations, delusions, disorderly thinking, movement disorder. I already read that part, didn't I? Flat effects, social withdrawal, and conversion defections, something like that. I have 5 minutes left, so I gotta quickly go on to schizoaffective disorder. Now this I'm leaning more to than I might have. Like I said, I haven't been lying to you guys about having schizophrenia, but for many years I have had tons of different doctors tell me one thing and then another. This is also to help me too. Schizoaffective disorder includes elements of both I can't even pronounce that word. Psych and mood disorder. Psychological symptoms mean a loss of conscience with reality. It may include hallucinations, hearing voices, or seeing things that are not present. Have that problem. And delusions, false, fixed beliefs. Symptoms of mood disorder include very low or very high mood with sleep deprivation, changes in energy and displacement connection, and generally poor daily function. Schizoaffective illness features a close encounter between these two sets of symptoms. Hygiene is a problem with both schizophrenia and schizoaffective disorder. I will go, honestly, I will tell you this. Before I started the clubhouse, now I have taken a shower 2 days in a row, and I haven't done that for at least 2 months. I mean, I've taken a shower before then, but 2 times in a row. I've actually gone weeks without showering because I'm in my house all the time. I isolate myself. I don't like to walk. I don't like to get out in society. And if you know my history, you will know why. And actually having the clubhouse has helped me, but that's a different story. Symptoms. Hold on. Yeah, these are the symptoms. Schizoaffective disorder is classified into 2 subtypes. Schizoaffective bipolar type and schizoaffective depressive type. There are some mental health professionals that believe schizoaffective disorder is a kind of schizophrenia. The disorder can be propagated because the symptoms of schizoaffective disorder are very similar of that of schizophrenia and bipolar disorder. That way you don't know that I'm lying to you. I want to tell you people, I never lie to my users. My subs and stuff, right there it is, and it says it. That I'm not lying saying that it's very similar disorders. And that's why the doctors have confusion with diagnosing me. But I just wanted to share this with you to know that I think I'm leaning more towards schizoaffective disorder because I never really had delusional thoughts. There was the time of me thinking that someone was after me. I always heard voices and I always seen stuff. But when I saw things, it was usually at night, and it would be of animals attacking me for some reason. usually a dog. I would see spiders. Sometimes I would have textual feeling that I would feel things crawling on me, and I would actually itch my skin and like really bad. But those are some of the symptoms I have had. But I never really had problems of like, well, I guess I do have problems with myself, but it's kind of really hard to explain. But I hope this video helped people that have schizophrenia or schizoaffective disorder, all confused like I am, that your doctors aren't giving you a right answer, you know, or have a hard time giving you an answer. But anyhow, and if you don't have schizophrenia or schizoaffective disorder, I hope this video has cleared some stuff up for you. Well, that's probably all the time I have right now, but thank you for watching, and this has been a Rainbow Vegan production. Bye!